Hello. Good morning. Hello.
Good morning, ma'am.
Okay, can you hear?
Yes, ma'am.
Okay, can you see the slide?
No, ma'am.
No? You can see slide? No? Hello?
No, ma'am.
Okay, wait. के भएर वेट Hello? Hello? Hello?
Yes, ma'am.
Can
Yes,
you
ma'am.
hear now?
Good morning,
Yes,
ma'am.
Yes, ma'am.
Slide now.
yes,
Yes,
ma'am.
ma'am.
All.
Okay, sorry, there was some problem, okay? In the network actually. So now you can see the slide, right?
Yes,
Yes,
ma'am.
ma'am.
Okay, so this is not very long topic also, very small short topic. So though we are 5 minutes late already, right? Okay, we'll go to the topic directly. Thoracic duct. Okay, in the first year in general anatomy, first semester, you have studied about the lymphatic, right? Lymph node, all those things. So same lymphatic duct, that is the lymph which is carried from the most of the part of the body is the thoracic duct. Okay, so this is about the, you can see, introduction part. So now while drawing also you have to remember the color of thoracic duct. Okay, so most of the lymph we have lymphatic, that is the thoracic duct, and right lymphatic duct. Okay, two ducts in our body which drain the lymph into the venous channel. Okay, so on the right side, small part of the right part of the body, the lymphatics is drained by the lymphatic, that is right lymphatic duct, whereas the most of the part of the body, the lymph, that is the lymph, okay, that is the fluid, is drained by the thoracic duct. So here you can see in the lower part, abdominal part, dilated part, that is known as cisterna chyli. So in the upper part, this dilated part become narrow and somewhat beaded appearance. Okay, you can see that somewhere it is, that is enlarged, and somewhere that is constricted. Okay, so you have to draw in similar pattern, that is constricted in between. Okay, that is the known as beaded appearance. So if you see in one only, you can see that is the valvular like appearance. Okay, so they have so many valves inside, so they are known as beaded. Okay, enlarged and again constricted, again enlarged and constricted, the beaded appearance of the thoracic duct. So you can see all this length is the thoracic duct and somewhat turning. Okay, so finally you can see the termination, drainage into the venous channel only. Okay, so lymph are finally drained into the, that is the venous channel. Okay, so now we'll go directly towards the thoracic duct only. So in our body, this thoracic duct is the largest lymphatic vessel. Okay, and drains the most of the lymph of the body into the, lastly final, into the blood stream, that is in the venous channel. You can see that is in the junction in between the, this vertical is the left. Now okay, thoracic duct will drain into the left side only. So left internal jugular vein and the left subclavian vein, in between there is angulation or the junction. Okay, that is the terminal part of this thoracic. So normally the lymph in the thoracic fluid white in appearance. Okay, that is white color. Okay, and contains, mainly because this is white, because it contains the fat. Okay, digestion from the intestine, that is carried by the this cisterna chyli. Okay, from abdomen the lymph is carried by the cisterna chyli and enters into the thorax as a, continue as in the thorax as a, that is the thoracic duct. Okay, so just now also I mentioned these are the beaded appearance you can see here. Okay, later on again, if you get time to see the cadaver, you can see later on, that is the thoracic duct. Okay, so beaded appearance mainly because of the presence of numerous valves. So there are so many that is beaded appearance throughout the thoracic duct. That means it has numerous valves. So if we cut, we normally we can see in the that is cadaveric portion also, because it is very thin wall and very small, right? Not like large size structure. It is not large. So after dissection also by ourselves we can see this all beaded appearance or valves in it. Okay. But it is said it is a very that is numerous walls are present within the that is thoracic duct, because of which it has beaded appearance. That is very important for your Viva also, even for MCQ also. Okay, beaded appearance. Whenever you write about the thoracic duct, you have to mention that it is beaded in appearance. Okay, and length you can see starting from T12. Okay, so upper end of the cisterna chyli. So length from this part till the termination part, it is that is round of 38 to 45 centimeter. So some books are writing like directly 45 centimeter in length. So you can keep the in the range also, that is 38 to 45 centimeter in the length, and only width you can see here only 0.5 centimeter is the diameter of the thoracic duct. Okay, so 38 to 45 centimeter is the length, and width is 0.5 centimeter. Beaded appearance and white milky structure is the content, that is the that fluid is that is milky white in appearance. Okay, and same thing here, sinus constricted in interval, that means same beaded appearance. Because of that beaded appearance, it looks like that sinus means dilated part, and in between you will get the constricted part. Okay, dilated and the constricted part, which will lead to the formation of that is beaded appearance of thoracic duct. Okay, and here at the terminal part, that is this bicuspid valve. Okay, two cusp part there, valve face into this vein only, so that whatever is entered, that is the fluid. Okay, that is that white milky white appearance fluid after entering into this venous channel, that is in the junction of internal jugular vein and the left subclavian vein, that shouldn't be again regurgitated into the lymphatic channel. So before this there is a presence of that is the bicuspid valve which face into the vein itself. Okay, or and the that is the beaded appearance. Just now also I have mentioned beaded appearance mainly for the that is the presence which denotes the presence of numerous valves within it. Okay, after that, so now for MCQ also, I think in the first semester also this we have already taught actually. So that is thoracic duct drains the lymphatic from whole of the body part. So you can see pinkish color in the picture. Can you see? Can you see your body, human body here? Yes. Hello. Hello.
Yes, ma'am.
Okay.
Yes,
This
ma'am.
okay. So this pink structure, every part except this bluish color, is drained by the thoracic duct. Okay. So all these picture you can see. So from lower limb, that is the left lower limb, right lower limb, abdomen till this area, and then this chest wall, upper left upper limb, and the anterior chest, posterior wall, and the this part of the head and neck. All this part is drained, the lymphatic from this whole part is drained by the thoracic duct, whereas the remaining part you can see the that is the right limb, right anterior chest wall you can see. Okay, and the right head and neck, and the you can see this convex surface of the liver. Now you have to remember abdominal organ, that is upper part of the liver is convex, so that part of the liver and the chest, that is the right side of the heart only. Okay, and the right lung, all these structure are drained by the right lymphatic duct. Okay, that also drain at the same part, that is on the right junction of right internal jugular vein and the right subclavian vein. Okay, junction of right internal jugular vein and the right subclavian vein, that is the drainage of right lymphatic duct. So from these small part only, whereas the remaining all part of the body, the lymphatics are drained via the thoracic duct into the venous channel or the blood stream, you can say. Okay, this you have to accept, you have to remember for MCQ, small part, either convex surface of the liver only, we can ask, right? Right half of the heart, right lung, and the right thoracic wall, or right part of neck, right upper limb, and the right the head. Okay, so remaining part will be drained by the thoracic duct. And now for exam, most important question is you have to remember formation, how thoracic duct is formed, okay, and the termination, how it is terminated into the venous channel. Okay, so this is question, mainly important question is this much, okay, from the thoracic duct. So we'll start with the formation. So you can see just now also we have mentioned about the cisterna chyli, that is dilated lymphatic channel in the abdomen. Okay, so this thoracic duct begins from the upper end of the cisterna chyli. Okay, that is at the part of the abdomen only. Okay, from the, now you have to remember body of 12 thoracic vertebra, that is the landmark you have to remember to write about the thoracic duct. So first part is upper end of the cisterna chyli, that is in the abdomen. Okay, after that you have to remember 12 thoracic vertebra. Okay, so this exactly start at the lower border of the body of 12 thoracic vertebra as a continuation. Now you can see this is the cisterna chyli upper end, so this directly continues as a thoracic duct. Okay, so upper end of the cisterna chyli, that is in the lower border of 12 thoracic vertebra. Okay, till here it is in the lumbar region, right? So from here it will enter into the posterior thoracic wall. Okay, so now here it lies in the L1 and L2 lumbar vertebra. While entering into the thorax, it lies in the 12 thoracic vertebra. So cisterna chyli is in the L1 and L2 vertebra, whereas the now thoracic duct in the body of 12 thoracic vertebra. Okay, for the relation also you can remember now from here it enters into the thorax now through the aortic opening. So again you will study diaphragm, that is the partition, okay, between the thorax and abdomen, thoraco-abdominal diaphragm. Okay, so musculo, that is the musculo-connective tissue structure, aponeurotic structure is there to separate between the thorax and abdomen. In that diaphragm, thoraco-abdominal diaphragm, there is an opening, okay, in the center, almost in the center, that is known as the aortic opening. Via this it enters into the thorax, that is the entrance of the thoracic duct into the thorax from the abdomen. Okay, and after that I think you have studied in the azygous system also, so somewhat you can cope up that correlate this thoracic duct with the azygous system also. So here you can see that blue color is the azygous system, azygous vein only, vertical you can see azygous vein. Okay, so now after entering into the thorax, that lies in the this part is which mediastinum, can you tell?
Posterior mediastinum.
Okay, posterior. Okay, mediastinum is also very, very important. Okay, structure lying in the mediastinum, posterior mediastinum. Okay, and the middle mediastinum is very, very important for exam also. So now one more structure added, right, in the posterior mediastinum along with the azygous vein. So now the thoracic duct ascends in the posterior mediastinum. Okay, and you can see this is the midline is almost in the, that is the vertebral body only is in the midline. Slightly towards the, this side is the right side and this is the left side. Okay, so it ascends in the posterior mediastinum to the right of the midline on the front of the bodies of thoracic vertebrae. Okay, so in the midline is the thoracic vertebrae, body of the thoracic vertebrae. It thoracic duct run slightly to the right of the midline. Okay, you can see this one. So you can see in the almost in the posterior thoracic wall you can see the color, and then you can see the thoracic duct, and more if you go more right you can see the azygous vein. So now it is running, you can see vertically it is straight running straight. So here it was, you have to remember 12 thoracic vertebrae. Now you have to remember the 5th thoracic vertebrae. Okay, so body of the 5th thoracic vertebrae. So that is the landmark type, okay, to remember the thoracic duct. So it is ascending on the posterior mediastinum, okay, in the posterior thoracic wall, and when it reaches to the fifth thoracic vertebra, body of fifth thoracic vertebra, now it is crossing the midline. So you can see some turning of the thoracic duct, okay. So first it was straight and then it is turning somewhat, or you can see inclined towards the crossing the midline and somewhat towards the left side, okay. So now it comes towards the left side, so you can see the relation with the aorta also, okay. So after that enters into the superior mediastinum, okay. First it was in posterior mediastinum, now it will move towards the superior mediastinum to run now along the left border of esophagus. Now we have removed the esophagus here, right? Okay, here it will be on the left end of the esophagus, okay. In this part it was posteriorly and somewhat towards the right side, okay. In the lower part, in relation to the esophagus it is somewhat posteriorly and to the right side. Now in the superior mediastinum it is on the left side, okay, left margin of the esophagus, okay, and reaches now to the root of the neck, okay. And now at the root of the neck in this part, okay, here you can see here superior mediastinum. After that, now you have to remember C7, that is the seventh cervical vertebra, okay. So seventh cervical vertebra, from here it is arching somewhat laterally, okay, upward and then moving downward, okay, and medially, okay. You can see here in front of the vertebral system. So that means it comprises of vertebral artery and the vertebral vein, okay. You can see here, okay, that is the arching. So first it was vertically upward and then at the level of C7 it is arching, okay, laterally and turning downward, okay, and terminate into the junction, okay, in this part only. So arching at the level of, now you have to remember, 7th cervical vertebrae, okay. So 12th thoracic vertebrae was one part, demarcation point. 5th thoracic vertebra is the second, and the 7th cervical vertebrae, okay. So now in the for relation also you have to remember now vertebral artery, okay, in front of the, that means posteriorly to the thoracic duct in the root of the neck are vertebral artery and the vertebral vein. Along with that there is the left cervical sympathetic trunk or the chain, okay. So that is also posteriorly related now. And another most important structure is behind the, that means anteriorly is the carotid system, okay. So vertebral system is behind, whereas the anterior to the thoracic duct is a large structure, okay, that is formed by the, that is the fascia, deep fascia of the neck, okay, that is the carotid sheath there, okay. So within the carotid sheath there is the now left common carotid artery, left internal jugular vein, and the vagus nerve in between the common carotid artery and the internal jugular vein, okay, longest vein nerve in our body, that is the vagus nerve. So sympathetic, that is the carotid sheath or the carotid system, you can mention. Within the carotid sheath there is the, that is content of the carotid sheath are left common carotid artery, left internal jugular vein, and the left vagus nerve, okay, one artery, one vein, and in the middle is the, that is the vagus nerve, okay. So now here that is arching at the summit is, that is 3 to 4 centimeter above the clavicle, okay. This arching is, if you take the from that is the part from the clavicle, it is around 3 to 4 centimeter above the clavicle, okay, arch or the summit. So now finally the dogs descend, okay. Before also I have mentioned first arch laterally upward and then again downward, okay, in front of the first part of the left subclavian artery, okay. So descend in front of the first part of left subclavian artery, and finally drains into the, that is the junction of internal jugular vein, that is left, and the left subclavian vein. Okay, you shouldn't forget to mention that is the left, not only internal jugular vein and the subclavian vein, but you have to mention left internal jugular vein and the left subclavian vein. So I think this diagram is sufficient to remember the course of the thoracic duct. If you draw this diagram, so you can correlate the azygous system also and the thoracic duct together. Okay, so that is the origin, course, and the termination, or the that end point of the thoracic duct. Okay, starting from 12th thoracic vertebra and terminate into the junction of internal, that is left internal jugular vein and the left subclavian vein. Okay, that is the origin, course, and the termination. So sometimes this is about the course only. So what are the anomalies and how you can identify there is some anomalies about the thoracic duct? Okay, so in the anomalies, normally how you can identify thoracic duct may be by dissection. Normally where you can dissect is the most of the lymphatic you can feel in the inguinal region only, right? So you can dissect, that is in the anterior and the middle side of the thigh where there are the inguinal lymph node, right? So if there are enlargement of the lymphatic channel, that time you can mention, you can go for the, if there might be some anomalies in the thoracic duct. Okay, or either that can be done by injection of, that is contrast medium. Okay, by you can inject the, that is the contrast medium, and then after that you will take the x-ray. Okay, that is plain x-ray, or it is good to see in the CT scan. So we will, that is lipidol, you will study later on in the x-ray. You have not done class also. This is the contrast medium, because of which that this liquid will enter into the duct, and you will that in the x-ray it will appear white, more white in the x-ray only, right? After the, that the passage of contrast medium, that is known as lipiodol. Okay, by that you can see whether it is in the proper arrangement, that is the thoracic duct is in the normal line, like we have seen. Now it is on the posterior thoracic wall, that is in the posterior mediastinum. It is arching somewhere here in the 5th thoracic vertebrae and the 7th cervical vertebrae. That portion you can see whether it is in the normal anatomical position, or whether there are some anomalies in between. Okay, about the thoracic duct. So most importantly, it is easy to and better to see in the CT scan only, right? Best view rather than the X-ray, normal plain X-ray. Okay. So here the same diagram only you can see, that is the cisterna chyli. Okay. So from the this dilated part, cisterna chyli. After that, you can see cisterna chyli in the L1, L2 body of the lumbar vertebrae. Okay, after that, that is the change in the orientation of the thoracic duct at the level of body of 5th thoracic vertebrae, and you can see in relation to the azygous vein also. Okay, and after that it is going towards the left side in the left margin of the esophagus and arching at the level of 7th cervical vertebra and the termination. Okay, in the junction of subclavian, that is left, and the left internal jugular. Hello? Hello?
Yes, ma'am.
Okay, sorry. Network problem only many times. Okay. So can you see slide now? Hello?
No.
No slide?
No, ma'am. No, ma'am.
Okay. Can you see now?
Yes, ma'am.
Can you? Okay. Okay, so this is in the, you can see this beaded appearance, white color. Okay, in the superior mediastinum part only, so you can see esophagus. So in the lower part of the posterior thoracic wall, in the or the posterior mediastinum, so same thoracic duct was on the posteriorly and somewhat to the right. So if you see in this part, that is in the root of the neck part only, you can see here. So first it is arching. So this you can compare. This is the esophagus. So now see the margin. So it lies in the superior mediastinum side. On the left margin of the esophagus is the thoracic duct. Okay. So it is arching over here. Okay. So posteriorly you can see the subclavian artery and the veins only. Okay. And then it is descending downward. You can see this is the thoracic duct descending downward to terminate in the junction of left internal jugular vein, which is vertically, and the that is the left subclavian artery. Okay. So after that, the relation. Okay, so that was about the course, okay, and termination and origin of the thoracic duct. Now in the relation also it is easy. If you remember where it was passing, then you can easily remember. Okay, what is this? Can you identify this structure? Can you identify this? What is this? Excuse me. Can you tell me what is this structure? This is the D diaphragm. Okay, diaphragm, that is the thoraco-abdominal diaphragm. Okay, this part only. Or in the central, you can see central tendon of the diaphragm, which is whitish in color, which is formed by the, that is aponeurotic part only. So now our part is this one. Okay, now you have to remember the relation in the aortic opening. We have different part, have different relation of the thoracic duct. So hello, can you hear? Are you hearing
Yes,
me?
ma'am. Yes, ma'am.
Okay. Okay. I thought you are not talking. I might disconnect actually. That's why. Okay. Now relation at the level of aortic opening, right? We have just now also mentioned first it was cisterna chyli, and in the upper end of the cisterna chyli, that is in the from the lower body of 12 thoracic vertebra. That is body of 12 thoracic vertebra was the, that is the thoracic duct. That is continuation of the cisterna chyli. Now this at the level of this aortic opening, now we'll study the relation of the thoracic duct. Okay, so now at the aortic opening, you can see this arc type, this red color is the aorta now. Okay, below was the abdominal aorta. Now after entering into the thorax, it will, that will be the thoracic duct. So now here at the aortic level of the aortic opening of the diaphragm, this part only, so relation is in front. So that is anterior to the thoracic duct. You can see there are the crura of the diaphragm. Okay, this is the diaphragm as a whole. So in between this one, you can see two crura. Okay, you can see the right and left crura. This and this is the right one is longer. Okay, and left one is short. Okay, that is the they are connect, these two crura are joining to form the arc like structure that is known as the median arcuate ligament, which is formed by the fibrous connective tissue only. Okay, so this, that is the median in the midline. So median arcuate ligament are related anteriorly to the thoracic duct. Okay, whereas posterior to the thoracic duct, that is the body of 12 thoracic vertebrae. Okay, so ligament, that is median arcuate ligament, right? So you have to remember median only, because lateral to the median is medial, and more laterally at the lateral, that is the lateral arcuate ligament that you will study again later on. For now you remember that is the median. Okay, MEDIN, median arcuate ligament, which is related anteriorly opening. On the right side now, side the azygos. You can remember on the right, azygos vein. Oh, that lies on the left side only. So in the right side only, okay, azygos vein, because that is the accessory azygos and the accessory azygos, that is horizontal running, is on the that is left side, whereas the azygos, which is vertically running, is on the right side of the posterior thoracic wall. Okay, and on the left side you can see the red color structure that is known as the aorta. Okay, so aorta lies on the left side, azygos vein is lies on the right side, anteriorly is the median arcuate ligament, whereas posteriorly is the body of 12 thoracic vertebra at the level of aortic opening. Okay, after that it was ascending vertically on the posterior mediastinum. So first of all, from starting from here only, right, from the diaphragm only, that part is the posterior mediastinum. So that means the first structure in the posterior mediastinum is, that is anteriorly related structure, is the diaphragm. That is the posteriorly sloping surface of the diaphragm. It is like dome shaped structure. So posterior sloping of the diaphragm is related anteriorly to the thoracic duct. Okay, along with that, that is separated, as now just now also we have mentioned, esophagus is lying somewhat anteriorly and somewhat to the left side. Okay, so that means anteriorly that esophagus also will come separated by the, that is the depressed area, recess or the cavity of the, that is pleural sac. Okay, so now behind, so again behind will be the body of the thoracic vertebra only. So in the body of thoracic vertebra, you can mention, if you want to mention, you can mention that is the anterior longitudinal ligament, which are attached to the anterior surface of body of the vertebra, all body. So we are mediastinum only. So posterior to the, you can see this is the line only dot appearance. That means these structures are lying posterior to the duct in the posterior mediastinum. That means lower part you can see hemiazygous vein running vertically, and then after that running horizontally to drain into the azygous vein. Okay, vertical azygous vein only. That means posteriorly to the thoracic duct, that is the hemiazygous vein, and superiorly that is the accessory hemiazygous vein also are in, that is posteriorly related to the, that is the thoracic duct in the posterior mediastinum. Okay, and the only the right posterior intercostal artery, which are the branches of descending thoracic, that is the aorta. So now on the right side now, so that was on the posteriorly related are the, this is the hemiazygous and accessory azygous vein. Okay, and the thoracic vertebrae. Whereas if you go towards the right side, this is the right side and this is the left side. So that means on the right side in the posterior mediastinum, the thoracic duct is related to the, that is the azygous vein. Okay, so long venous channel present on the posterior mediastinum, right side of the midline, is the, that is the azygous vein. Later on, if you get chance to dissect this structure, you can see easily and very prominent, and even for the sporter structure, it is very important. That is the azygous vein. Okay, very prominent structure on the posterior mediastinum, the azygous vein. Okay, and on the left side, there is the red color structure that is on the descending thoracic aorta. Okay, so that is on the right side is azygous vein, that is venous channel, whereas on the left side now you will get the descending thoracic aorta. So this is the relation in the posterior mediastinum. Okay, so first at the aortic opening, after there in the posterior mediastinum, now in the superior mediastinum. So if you remember the course, then also again you can relate the relation over here also. Okay, so now in front, okay, in front of the, in the superior mediastinum, first that is the ascending aorta was there in the heart. From the ascending, then it will form the arch of aorta. Okay, so arch of aorta is lying anteriorly thoracic duct in the, that is in the lower part. Okay, this in the superior mediastinum also in the lower part, and it is related to the arch of aorta, whereas in the upper part again it is related to the left subclavian artery. Okay, so two structure anterior related, that is the arch of aorta. After that, the its own branches, that is the left subclavian artery. Okay, anteriorly to the, that is the thoracic duct in the superior mediastinum. Okay, so we have removed here arch of aorta. So after that, behind again, that is the bodies of upper four thoracic vertebrae behind. So posteriorly you can remember the vertebrae only. Okay, upper four body of the thoracic vertebrae. Okay, 1 2 3 4. Okay, and now on the right side now, so this is the thoracic duct. So on the right side now is the esophagus. Okay, and on the left side there is the apical region of the lungs and the pleura. So here in the neck you will get, that is the lungs, apex lungs, and the covering of the lungs, that is the pleura, that is also left. Okay, on the left side, this is the left side now, on the left side are the left lung and the pleura, on the right side is the esophagus. Okay, that is in the superior mediastinum. So now again this diagram. So at the level of the root of the neck, okay, this is the root of the neck. So in the root of the neck, we have just now also mentioned anteriorly is the left carotid sheath. Okay, we have both on the right and the left side two carotid sheath, that is the right carotid sheath and the left carotid sheath, which comprises of, on the left side we are mentioning, that means that is the internal jugular vein, largest, that is the venous channel which drain from the head and neck actually. Okay, that is the internal jugular vein. After that we have middle, in the middle we have the left vagus nerve, and after that is the, that is the internal carotid artery. Okay, carotid artery. Okay, that is the left carotid artery. These are the content of the carotid sheath. Okay, carotid, spelling wrong, carotid sheath. So anteriorly to the thoracic duct in the root of the neck is the carotid sheath, and now behind, okay, behind are the structure, that is the left sympathetic trunk. Okay, after that is the first part of the vertebral artery, which is the branch of again subclavian artery only. Okay, so first part of the vertebral artery and the corresponding, that is vein, that is the vertebral vein only. After that, there is the branch of the, you can see that is the thyrocervical trunk. Here you can see that is also branch of the subclavian artery only, thyrocervical trunk. And one muscle you can see, so this is in the ribs also, in the first rib also you have studied this muscle, right? Scalenus anterior, that is scalenus tubercle was there in the first rib only. So this scalenus anterior muscle is also related posteriorly to the, that is the thoracic, the left sympathetic trunk. First part of the vertebral artery, we have three part of the vertebral artery, so only first part along with the branch of thyrocervical trunk and the left scalenus, that is the anterior muscle, and in front that is the resting on the scalenus muscle. Anterior to this scalenus anterior muscle is known as the left phrenic nerve to supply the diaphragm. Okay, now we supply the diaphragm, that is known as, from its name itself, that is the phrenic nerve. So that means left phrenic nerve is also related anterior, that is the posterior to the, that is the thoracic duct. It is anteriorly to the scalenus anterior muscle. Okay. So after that, what are the tributaries of the thoracic duct in the different parts of our body? Okay, you can see these are the tributaries. You can see like the vein. It also has the tributaries which will drain the lymphatic from the different part, that is interstitial tissues and the different organs and the part of the body. Okay, so in the abdomen, the, that is the thoracic duct will drain the lymphatic via this one, lower six intercostal lymph node of both right and the, and drain into the thoracic duct. Okay, so efferent from the lower 6 intercostal lymph node of both right and the left side will drain into the thoracic duct. So after that, in the thorax now, there are two lymphatics. The only name you can remember, okay? Pair of acid lymph trunk and the pair of descending lymph trunk. Two, if you remember, that is sufficient, okay? Pair and the lymph vessel from the posterior mediastinal lymph node. So these three are draining in the thorax into the thoracic duct. Okay. So now in the neck, directly you can see largest, that is channel only left jugular, internal jugular vein type, jugular lymph trunk. Okay, drain from the neck part only, left subclavian lymph trunk, because node, so that area will drain by the similar name only, left internal jugular vein. Along with that, around that area you will get the lymph, that is the jugular lymph trunk, and around the subclavian vein you will get again the left lymph trunk, and the bronchomediastinal trunk that lies in the, that is the between the, that is the and the mediastinal. Okay, that lies the bronch. These are the, these are the area that is known as mediastinum, right? In between these lungs and this area, you can see the bronchi, okay, and the, this is the mediastinal surface. Here lies the, that is the bronchomediastinal lymph node only. Thoracic duct. So here also you can see a small part. This is the esophagus. Here you can see the thoracic duct. So as you know, this thoracic duct is draining from the most of the part of the body, right? So there is more chance of spread of like cancer from these organs, like, okay. So thoracic duct drain from the abdomen as well as from the, that is the testes, right? Okay, so cancer from these, any of the organs or any part of this organ, finally that drained into the, that is left supraclavicular lymph node. Okay, so now you have to remember, in the left, just above the clavicle, if there is cancer of testes or the stomach, then you can directly supraclavicular lymph node, mainly on the left side only. Okay, so this lymph node, that is left supraclavicular lymph node, lies at the root of the neck, and if there is a physical condition, these lymph node get enlarged first. Okay, that is like, that is the sign of the enlargement of those organs. Okay, so these lymph node, that is supraclavicular lymph node, are lying, that is superficially, and you can test is very easily because it is superficially in the root of the neck. Okay, so these are also known as the, because of that they can be felt easily because of their presence superficially. These are also known as the signal lymph node of our body. Okay, they are showing the sign there is some change in your body. That's why they are known as the signal lymph node of our body, that is left supraclavicular lymph node. So for MCQ, you have to remember there is a left supraclavicular lymph node, that is known as the signal lymph node of the, that is the testes also, and even the stomach also. Okay. After that, these thoracic duct, as we have mentioned, they are very thin wall, right, and they are very close, approximate with the esophagus also. So during surgery of the esophagus also, and they, because of different, that is turning and twisting orientation also, you can see some, before it was in the posteriorly, and the, that is somewhat was the right side, again it is turning, that is changing its course from, that is midline towards the left side. So we have to be very confident about the course of the thoracic duct also while doing the esophageal surgery, because of the different turning of the posterior and the median. Okay. So because there is very much chance of laceration, okay, and which may lead to the life-threatening condition of the person, and very difficult to manage. That is, it is mentioned like 50%, even there is high rate of mortality after the conservative management also. That is 50% chances, okay, of mortality rate, okay. And this is the only term only if there is rupture of the thoracic duct, that is known as the way. If it that is the what to say, if you cut the thoracic duct in the thoracic region and that is the fluid get out from that duct, that is known as that is chylothorax, if it is in the thorax only, okay, if it gets ruptured only. And that is just also I mentioned this one, various course of the thoracic duct coupled with the failure to identify it at the surgery and may lead to the inadvertent incision or there is a transection of the thoracic duct, because just now we have mentioned the course of thoracic duct. So you need to know the course of thoracic duct while doing the surgery of the thoracic region, okay. It is very thin and looks like, if exact, that is beaded appearance of, you can't see in, like in the diagram you can draw, but in the cadaver you can't see exact that beaded appearance of thoracic duct. And this duct, again, there is chance of damage of duct while removing the supraclavicular lymph node. So if there is the cancer of the just how I mentioned stomach or the testis, in those cases this lymph node get enlarged. So in that case we need to remove this lymph node also, that is supraclavicular lymph node. In that case we have to remember the course of this thoracic duct, so that will not dissect the duct and preserve the thoracic duct. And one more thing, even in the microbiology, this one I think, that is the thoracic duct may be obstructed by the growth of filarial parasites also, and producing sometimes that is bursting of the thoracic duct also. This will lead that is the fluid, lymphatic fluid, either in the pleural cavity that is in the thorax or the peritoneal cavity that is in the abdomen, okay. So if it get collected in the pleural cavity, that is known as the chylothorax in the thoracic, okay. So now, so in the gist, actually thoracic duct, the major now can like which drain the fatigue from the part of the, except the few part of the left side only. And finally it drains into the junction of left internal jugular vein and the left subclavian vein, which unite again to form the left brachiocephalic vein, okay. And left brachiocephalic vein with the and drain into the that is superior vena cava only, okay. That is about the thoracic duct. So finally it will drain into the venous channel only, okay. Tissue, and final is the venous channel only, okay. That is about the lymphatic duct. So from this topic, the distributaries only, if you can remember you can read, otherwise you need to remember most important is origin, course, relation and the termination, and the at least you have seen the question till now. So for everything you are at least two applied aspect of each topic you have to remember. And diagram is very important, okay. For all the question you have to draw diagram, whether it is asking in the question or not. In anatomy always you need to draw the diagram, okay. If you miss the diagram, half of the marks you will miss, okay. So don't forget to the diagram in the anatomy, whether it is asked like with the help of diagram or it is not mentioned. Always we can mention that diagram is needed. So from here only in the class only I am telling diagram is very in the details. If there is no diagram, your marks will be deducted, okay. Clear? Are you clear? Hello.
Yes, ma'am.
Okay, so this diagram you draw because while drawing this thoracic dog diagram, keep your mind that is you have to correlate with the azygous system only. If you know azygous system diagram, thoracic dog also will come. If you know thoracic dog diagram, azygous, in both way it will help. Okay, you don't need to draw twice. Okay, if same diagram if you practice in the thoracic dog also you can draw, and even in the azygous vein also. Okay, same diagram you can practice for both azygous system and the thoracic duct also. Clear? Okay, second question is not not in this topic. If you can remember few lymphatic, because in each topic it will come the lymphatic, like in the mediastinum again that lymphatic will come, and in the lungs again the in the broncho main. Okay, in those areas there is the lymph node of the thorax will come. Okay, there only we'll discuss one by one. If you remember that much is sufficient. So mainly course or origin, course, termination, and the at least one or two applied aspect you need to remember from the thoracic duct. Okay, clear?
Ma'am.
Yes.
Ma'am, that supraclavicular will directly join into thoracic duct or indirect.
Supraclavicular also indirectly, yeah, they are the lymph node only, right? They will drain indirectly only, because they will again form the channel, and in one part they will drain. Okay, these are like in other part also we have different lymphatic channel, right? Lymph node. Okay, in the similar pattern they are also will drain into the, that is the thoracic duct only. Final drainage is the lymphatic, that is thoracic duct only. Okay.
Okay.
Like we have studied in the inguinal lymph node and in the axillary lymph node, similar pattern only they will drain, not directly into the thoracic
And,
duct. Yes.
and there is more risks while that cutting supraclavicular lymph node of that thoracic duct can also be cut.
Yeah, there is in close relation actually. In the that is also lies in the, that is the root of the neck, right? So our thoracic duct course also in the root of the neck. That's why only. Okay, they are in close approximation, right? That's why there is chance of cutting off, that is thoracic duct, while removing the, that is the supraclavicular lymph node. Left only. Mainly you have to mention left supraclavicular lymph node. Okay. If there is like carcinoma of the testes, and mainly you can remember these two examples, stomach and the testes. Okay. If there is carcinoma there, then the supraclavicular, left supraclavicular lymph node also get enlarged, and you can palpate and feel that enlarged actually. So if they are enlarged, you can suspect for those two things also, right? Stomach also and the testes also. Go for that. These are, we can go for the checkup of those things only. Okay. Clear? Okay. Any question? Wait, okay. So please draw the diagram. I'm not giving separately homework. Okay. So first question you can take as a homework also, and you can make note according to that. So I think everything, whatever you need, I don't think you need to read book for this topic. Wait, Okay, download attendance. Okay, thank you, class. I have to stop recording, right? Okay, thank you.